I'm Dr. Bill Lawler. Good to be here with you tonight. I am a practicing pediatric family chiropractor in Alpine, Utah. I've been doing it for a long time, over 3 decades, and still get a kick out of it, enjoy it. And we're going to talk about something tonight, or whatever time of day that you might watch this, about how often should you go to a chiropractor, which immediately brings up the question, well, why should you go to a chiropractor anyway? And there's a lot of different reasons to do that, a lot of different reasons that people do come to chiropractors, and we're going to take a look at that. So there's certainly some debate about going to a chiropractor. If you Google anything today, you can find all kinds of answers, but don't do that. Listen to me tonight and see what it is that I have learned after almost 4 decades of practicing chiropractic. So let's look at a few reasons of why people go to chiropractors. Some of them you got to guess. Pain, yes. Lower back pain. 80% of all adults will experience back pain. That's from a research study. Neck pain. 20 to 70% of all adults will suffer it at some point in their lives. From acute to chronic, which acute means quickly, a short period of time. Chronic means long term. Headaches, 50 to 70% of people have headaches. And all the people that I see, I tell them that is not normal. Having a headache is not what we were created to do. I'm not saying it's not usual, not frequent for a lot of people, but it is not normal. It is not a good thing. It's not something that hopefully you have to live with. Now there's lots of reasons for headaches other than just what chiropractors can do. I'll tell you a quick story. I was practicing in the state of Maine, and a guy came into my office, and he said, I'm coming in for headaches. And I said, okay. And he said, yeah, and I have a little bit of a problem with coffee. I said, well, what does that mean? He said, well, I have about two a day. And I said, well, 2 cups of coffee. I've heard of much worse than that. And he said, no, actually, it's 2 pots of coffee a day. I said, okay. And I actually said to him, look, if you're going to keep doing that, I don't know that you should waste your time and energy and money on coming to see me, because that is definitely not good for you, and that's way beyond what your body can handle, and in fact, it's not a good thing. So he did work slowly to decrease to a more normal, much less amount, and we worked on helping him chiropractically, and he ended up not having any more headaches. Migraines, 12% of the population have that. That's a lot. That's terrible. Talked to a woman today and even asked her in the last week how many headaches have you said she had 3. That's 3 too many. That's a lot. Car accidents, physical trauma or strain, fall, sports injuries. I didn't put that in there. There should be tons of that. Sports injuries, going to a trampoline place, going to a water park, going to an entertainment place that has roller coasters, etc. All kinds of ways that you can get your body messed up, subluxated, and unhappy. Another couple going a little bit further down the road, thinking outside the box of just pain to increase physical performance. Most pro sports teams have chiropractors because there's a lot of physical trauma there, and they also want to enhance their performance. Some of the greats, Michael Jordan, many other great athletes have said in track and field, in sports, in football, even dating way back to Babe Ruth in baseball, chiropractic made a big difference for them. Not just pain relief and help, but also enhancing performance. And then to change or correct chronic pain, posture, and spinal issues. Okay, those are some reasons. Now I'm going to give you a whole bunch more, 2 different groups. Babies and toddlers. Why would a baby see a chiropractor? Well, just last week, 2 very colicky, unhappy babies came in. One was 2 months old, one was 5. Screaming at night, screaming in the day, not eating well, not digesting, having constipated, tummy upset, all kinds of issues. Yes, that is something that can correspond and be helped by chiropractors. I did another video on babies in particular, so you can look that one up for more detail. Spitting up, uncomfortable, failure to thrive, progress, failure to progress, not latching on. Toddlers. I looked at a couple different studies, and one said 38 times a day average, and another one said 17 times an hour, which was an actual survey of, I think this was a guess, this was a survey of about 200 to 300 babies, and the parents actually measured how many times their kids fell in an hour. That's a lot. They need some help. Adolescents, scoliosis, definitely better to get checked pre-puberty than post. A lot more can be done to actually help the curve pre-puberty than it can post, because post things get a little more solidified and much more difficult to improve and help. Growing pain, sitting a lot, sports, musical instruments, and the number one of all is technique, having a head down. We adjust many adolescents because their head is always down. Not good. And then posture issues, which leads right into that. So, all kinds of other things and reasons why people come in. Adults from 18 to 97 plus. Oldest person I've ever adjusted was 97. So I said plus because I don't have experience with that, but I know they do get adjusted. All kinds of reasons why they come. Stresses, physical, emotional, mental, spiritual, moving, lifting, changes in job location, children issues, falls, poor sleeping, all the other things we said, etc., etc. So now we're going to go a little bit beyond that to 20 more reasons. I'll just take you quickly through this. Improving joint mobility. Imagine that. Makes tight muscles loose and loose muscles tight. So that's kind of a play on words there. Figure that out. Decreasing degeneration. Helping situations like this where we don't want to ever see anybody down here. We want to keep people here, and from here to there. This person's not going to get back to there. And this person, we're just trying not to let them get to here. But degeneration, big reason why people come and we try to help them along the way. Ongoing inflammatory processes, help circulation, speed up recovery, improve the nervous system. How big is that? That's pretty dang big. What percentage of the body does the brain innervate or supply with nerve messages and control? 100% of the body. Strengthen the immune system, organ system, disposition. They can even be more fun to be around. You may know an ER that you would like to get a little bit of chiropractic care, see if we can do an attitude adjustment. Calms the hyperactive mind, increases energy, vitality, and improves sleep. This is true. Relieves, improves prenatal discomfort. So pregnant women, definitely. We see lots of pregnant women, and they are definitely helped. Decreases length of labor, intensity associated with back pain, decreases adverse effects of stress. We already talked about athletic performance, improves quality of life, prevention of sickness, disease, and pain, overall health, wellness for infants and children, improves cognitive ability. First chiropractic adjustment ever given was to a man D.D. Palmer gave to Harvey Lillard, 1895, specifically September 18th, just about a week ago. And that was given because Harvey Lillard had bent over, heard a pop in his back, came back up, and he couldn't hear. So it sounds like a fantasy story maybe, and I won't disclose the name of a woman, but a woman did come into our office in the past few months, specifically for hearing issues, and lo and behold, she now has her hearing back. Chiropractic works because it helps the body heal itself. All right, I'm going to keep going. Other groups of people that certainly benefit from chiropractic. We talked about pregnant women, the baby's positioning. I did another YouTube video on that, on what's called the Webster technique. And helping the Webster technique means balancing out that sacrum in the back, helping get pressure off the ligament in the back of the spine. Here's my handy dandy prop. So getting pressure off the spine here, very gentle, working here, and then having the woman be also on her back, working on the broad ligament and the round ligament right here. That helps the ligaments to relax and therefore can help the baby's positioning. Allergies, heartburn, that was my story, told it many times, but I had heartburn all through my teenage years into my 20s and decided to become a chiropractor, got checked out. Chiropractor found a subluxation misalignment in my spine that I did not know I had. When he touched my mid back, I said, actually, that's kind of tender. There was a subluxation, it got adjusted, and lo and behold, heartburn of 10 plus years went bye-bye. can help vision, hearing, just talked about athletes, young active people, old stiff people, men, women, children, babies, and even animals. Haven't done many, but there are many chiropractors that do work on lots of animals, and there's a specific branch of our profession that does work on horses with great results. Okay, so now let's talk about how often. I tell people right away when I talk to them the very first time that some chiropractors treat their patients like an aspirin, sort of a fix. So they come in, they get adjusted, get a little pressure off a neck, a mid-back, whatever it is, and that's it. So it's just a very short relationship. Because I've done this long enough, I don't cater to that type of a client. I am looking for someone who wants to get educated and see beyond just the pain into the amazing nervous system that, yes, I show this also all the time, but it's just a big deal to me, and that is what this looks like. Everything is controlled by the brain. Do you want your brain to function well? Do you want your nervous system to function well? Well, I do, and I've been getting adjusted now for 40 years, and I have no intention of stopping anytime soon. I got adjusted today. So, correction, that can be pain relief. If you go beyond just a 1-2 quickie, correction of chronic spinal issues can be 36 to 100 visits. Goes along with the chart we have here on subluxation degeneration. Babies, usually 8 to 12 visits, we can make a massive difference in their little teeny life because they haven't had 5, 10, 20, 50 years of having things messed up. It's just a few days to a few weeks or months. Wellness. Do you want to go see a chiropractor for wellness? How long do you go see a dentist for? As long as you have teeth. Well, how long should you go see a chiropractor? In my opinion, what I am doing, what I advocate to my patients, to my family, to my children, to my grandchildren, is to get checked on a regular basis for the rest of your life. So, there it is. How long do you go to a dentist? How long do you want to eat well? How long do you want to exercise? How long do you want to get good sleep? Let's talk about lifetime wellness care. I happen to have 6 children. Some of you know that, some of you don't. I went to a seminar about 25 years ago. The chiropractor said, how often do you check your spouse if you're married and your children if you have children? My answer was once every a week to once every 2 weeks. That's what I do. That's what I always have done. That's what I've always recommended. And he said, well, could you afford your own fees? And I thought about it and I said, well, whatever I was charging at the time, times 8 of us every week, I said that would actually get a little pricey. So I was told about a wellness care plan that is not a per visit thing, but a per month fee. And we have many, many families and individuals doing that in my practice here in Utah. And I know of many chiropractors that do that throughout the world, throughout the States for sure, and throughout the world. So we would invite you very upfront about this. People say to me, how often should I get adjusted? Depends on what you want. How long should I get adjusted for? As long as you want to be healthy, as long as you want to be well, as long as you want to have wellness. So you decide when that is, but we have created a vehicle that makes it easier for you to do that and not have it be financially challenging or difficult, but a way that you can come in yourself individually or your entire family. We have families of 6 kids, of 7 kids, and we love them. And they have grown up with us and with chiropractic. And a lot of them use us as a first resource. And if you got something more serious, we'd be happy to send you up. Don't come here with blood. Don't come here with a broken bone. Don't come here if you're barfing. All the other stuff, we'd be happy to check out first. So that's the answer. So here we go. 2 pictures to contemplate as we close this out. And obviously I got this online. Obviously it's a guy, I don't know that he has COVID. I don't know what he's got going on. He just doesn't look great. He was telling the person, wait just a sec for me to take a picture. That's how I envisioned anyway. I got to blow my nose. Doesn't look incredibly happy. He's got the scarf on. He's got the warmer clothes, got the hat on. I'm guessing he's not feeling great. And we're going to, for this, the purpose of this particular video and workshop, going to say he doesn't have great habits, and therefore he probably doesn't exercise enough. He doesn't have good enough nutrition. Hasn't got good drinking water habits and all kinds of other things. Yes, he could have genetic issues that have caused stress on him, but for the purpose of this discussion, we're going to say that unhealthy habits have led to him not feeling so good. So the picture I'm going to leave you with is this one. Now look at that. Don't you want to have your hair blowing? I don't have any hair to blow, but flapping in the wind. You're out running. It's a hard to say whether it's a sunrise. We're going to go sunrise, and healthy choices and a lifetime of chiropractic care. You can tell that that person on there has had a lot of chiropractic care. There's a vibrancy about her that you can just tell. So, quick review. We are going to say that, in fact, I guess that's it. We're going to go this way, lifetime chiropractic care. That's how often you should come in and get checked. I did something I messed up. But anyway, I love chiropractic. I love what it does for the body. It is not enough by itself, though. You need to have good habits with it. You need to have good exercise habits, good nutrition habits, water habits, doing things, good, effective sleeping, finding ways to de-stress, finding ways to breathe and be more at peace and calm. All those things, the part we can help you provide you is, in fact, the chiropractic piece. So, would welcome any questions or comments. Would love to give me a good comment. I'm willing to give away a massage. Anybody listen to this long? I'm happy to give away a free massage to our amazing massage therapist. Give me a good question and you get a free massage. Okay, great talking to you. Take this to heart. I know what I'm talking about. I've been doing this a long time. Would love to help you or anybody else, or send you one of my colleagues throughout the world. Thanks.